today's lecture, I will show you our hypothesis. Acupuncture go through opioid system and the orexin endocannabinoid system, two independent pathways to activate analgesia. Also, for the long-term pain management, acupuncture can downregulate microglia and the astrocyte to decrease pain, hypersensitivity, and the risk of chronic pain, and also the CNS injury-induced neuroinflammation. Alternatively, we can topic apply method act on TRPMA receptor to downregulate microglia and astrocyte to reduce neuroinflammation. So today I hope to convince you the mechanism of acupuncture like this. So acupuncture is the needle plus puncture, and it involves the stimulation at a specific location of the body, and it's called acupoints. Acupoints are along with 12 meridians and the 2 vessels, and we all know that. And the stimulation can be manual acupuncture, can be manual electrical or other forms. So it is manual acupuncture, electroacupuncture, or other form like laser acupuncture. So the WHO published a review indicate that acupuncture was effective for 28 diseases and beneficial for 63 others. But acupuncture is used most commonly for pain treatment. The efficacy of acupuncture on pain is well established, and this was demonstrated by many randomized controlled trials and the meta-analysis. But how about the mechanism? And we have a review paper about talking its mechanism. So the first question is peripheral nerve activation involved, since acupuncture needle is acting on the periphery. For this question, as early as 1973, they found local anesthetics can block acupuncture analgesia. So at that time, people already know peripheral nerve activation is required for acupuncture analgesia. And in the 1970s, people begin to know naloxone, the opioid receptor antagonist, can reduce the acupuncture analgesia. So at that time, they hypothesized the release of morphine-like substance after acupuncture in the CNS. And in the 1980s, endogenous opioid was isolated and purified. So scientists found that after acupuncture, this endogenous opioid level was increased. Then it forms the endorphins theory. So after acupuncture or electroacupuncture, our body can release endogenous opioid and act on opioid receptor and contribute to the analgesia. Then the release of opioid and will activate the descending pain inhibitory pathway. This pathway starts from the periaqueductal gray, PAG, then it's project to different level of spinal cord and releasing inhibitory neurotransmitter. So the pain sensation was decreased. Then it caused this is called a descending pain inhibitory pathway. But from the literature, so we know in some basic research, naloxone usually can reduce EA analgesia, but does not completely abolish it. And in some conditions, naloxone even has no effects. And in some clinical trial, naloxone fails to reverse the pain threshold induced by acupuncture. So there's a question. In addition to opioid, is there any other important acupuncture analgesia CNS mechanism? To answer this question, we have a paper published in 2018 in PNAS, and we indicate there is an orexin-initiated endocannabinoid pathway in the PAG. So orexin has orexin OX1, orexin A and orexin B is a neuropeptide discovered in 1998. The receptor has orexin OX1 receptor and the orexin OX2 receptor. The orexin neuron was located in the hypothalamus and project to different brain area. And the orexin is something to do with the arousal, feeding, rewarding, and the pain regulation. And according to our paper's conclusion, if we do the electroacupuncture at the PC6, it can activate the lateral hypothalamus orexin neuron to release orexin to PAG. And the released orexin can act on the postsynaptic neuron and synthesize endocannabinoid and act on presynaptic CB1 receptor. Then the releasing of GABA is decreased. Because the decreasing GABA release, the postsynaptic neuron is activated. Then it activates the descending pain inhibitory pathway to cause the analgesia. So we indicate a different pathway, right? But if this pathway is really independent from the opioid system. Okay. Oh, so if it's independent from opioid system, then EA should still working in the morphine tolerance mice. So we have next research. We use chronic constriction injury. So after 1 week, this is the pain response. If we treat morphine, it's very effective to reduce pain. But if we treat morphine every day, the morphine's effects is gradually decreased. So this is morphine tolerance. But in this kind of mice, if we treat EA at the PC6, then it's still working. Okay. Even we let the mice develop very high dose morphine tolerance from 10 to 50 milligram per kg. Then if we treat EA at the PC6 内关, it's still working. So this means there's a really two pathway. One is opioid pathway, one is orexin endocannabinoid pathway. And we use the same protocol to test other acupoints. So you see LI4 still naloxone insensitive, but ST36, this is naloxone sensitive. So it means ST36 is more opioid dependent. So this also tells us different acupoints engage different analgesia pathway. So last year, we have a paper talking about the TRPMA receptor is the modulator between these two pathways. Okay, so between this opioid and the orexin endocannabinoid pathway, TRPMA is one of the thermal trip receptor. Thermal trip receptor is a receptor in the skin and detecting the temperature. For example, there are TRP V1 to V4 to detect the heat. But TRPMA is detecting the temperature to 8 to 28 degrees. So if the temperature is 8 to 28 degrees, the ion channel of TRPMA is open. Then activate the peripheral nerve, then send signal to spinal cord, and to the brain to cause the cooling sensation. So TRPMA receptor is widely distributed in the body. But if we activate the TRPMA receptor, it can also cause the analgesic effects. It is believed this is something to do with kappa opioid system. Okay, and the menthol is the agonist of the TRPMA receptor. And the TRPMA receptor will increase after nerve injury or inflammation. But why is not clear. But we are trying to testing if TRPMA receptor can modulate these two pathways. And we perform this study. We do EA at GB34 and LR3. Okay, and we inject the CFA to cause the long-lasting inflammation pain state. And we testing the bone free to detect the mechanical allodynia. As you can see, after CFA, the pole withdrawal threshold was decreased. So this is the pain, mechanical allodynia. And if we do EA, it reverses the effects. Okay, so this is the EA analgesia. And the naloxone can decrease the EA analgesia. Also, AM251. AM251 is endocannabinoid receptor antagonist. So this is opioid-dependent pathway, and this is the endocannabinoid pathway. So there are two pathways, involve two pathways to cause the analgesia. And if we use TRPMA antagonist, AMTB, and we found very strange, naloxone has no effects. Only AM251 can reverse the effects of EA. So it means there's endocannabinoid-dependent pathway still here, but the opioid-dependent pathway is gone. So it means if no TRPMA receptor activation, no opioid pathway, even we use the TRPM8 knockout mice, so you see naloxone still has no effects, but AM251 can reverse the EA analgesia. So it means still we see the endocannabinoid pathway, but the opioid-dependent pathway is gone. How about we activate the TRPMA receptor? So we activate this receptor by menthol. Okay, as you can see, this is EA analgesia. But if we apply menthol together by oral administration, you can see the EA analgesia was increased. Okay, so this study tells us GB34 and LR3 electroacupuncture can activate the opioid pathway and the endocannabinoid pathway to cause analgesia. But the major pathway is opioid pathway. But this pathway activation needs the presence of TRPM8. If no TRPM8 receptor activation, there's no opioid pathway. So this study tells us the activation of opioid pathway needs the presence, needs the activation of TRPM8 receptor. Okay, then we check the glia cell. The glia cell in the CNS is to support, nourish, and protect the neuron. So one of them is microglia. The microglia can be activated after the brain or spinal cord injury. So it will become activated. So the soma will enlarge and the process become thick. If the situation resolves, it's become to resting state. But if the situation did not recover, so it continue to activate it and release cytokine. So this is the microglia, it's CNS immune cell. Glia cell has many physiological functions, but one of them is to interaction with microglia to induce innate immune response and the response to the injury. So now we know pain induces spinal cord microglia in almost every kind of animal model of pain. If we can inhibit spinal microglia activation, we can also reduce pain. And we have one paper talking about if we activate the spinal cord microglia with lipopolysaccharide, it can release ATP and activate the astrocyte. The astrocyte will release glutamate to presynaptic neuron. And the presynaptic neuron will release more glutamate to produce more, this is pain neurotransmitter. So it means if we activate the microglia, it contributes more pain response. So we want to know, can acupuncture reduce this response to reduce pain? Okay, so we have a paper, we use the dental pulp injury model. So dental pulp injury is the damage of trauma to the dental pulp, and it can lead to the symptom of pain, and it can be the highest level possible. So it's very painful. Okay, and the trigeminal nerve provides the sensory input to the VC area, trigeminal subnucleus caudalis in the medulla. Okay, so now we know if there's a dental pulp injury can activate the microglia activation here. Okay, in the VC area. So we drill the first molar of the mice to cause the dental pulp injury of the mice, and we do local and the distal EA. So as you can see, this is the head withdrawal threshold. So after the DPI, dental pulp injury, this threshold decreased very much. So this is mechanical allodynia. And the EA can reverse these effects. Also ibuprofen. And sham EA has no effects. So this is day 1, day 3, day 7, day 14, day 21. As you can see, on day 21, almost there is no pain because the nerve of the tooth is necrosis. So at that time, no pain. But even no pain, but the microglia in the VC area is continuously activation. So the activation of microglia and the astrocytes ongoing until day 28. Okay, but if we perform acupuncture, electroacupuncture, it can decrease the microglia activation, also the astrocyte activation. So this tells us even the pain very severe on day 1, but gradually decrease until day 21. There's no pain on day 21. But even so, the microglia is still activation on day 28. But if we can use acupuncture to decrease pain, the microglia can only activate it at a minima level. So it tells us pain need to be treated so you can keep the microglia more calm down at the resting. So because the activated microglia astrocyte is very dangerous, let me show you. So if we do twice dental pulp injury in 7 days, you see what happened. Okay, if we just do 1 dental pulp injury, on day 21 it's almost recovered and completely recovered on day 49. But if we do twice DPI, and you can see the pain is long lasting and did not recover. So this is the chronic pain. We think this is the chronic pain until day 70. And what we see, so if we check the microglia state, if we just have the 1 DPI, it recover on day 70. But if we do the twice DPI, then there's no recover. So at the day 70, the microglia is still reactive. Also, we see the GABAergic nerve fiber is decreased on day 70 if we apply 2 dental pulp injury. But single dental pulp injury has no these effects. So it means maybe the reactive astrocyte and the loss of GABAergic neural fiber cause the chronic pain in this model. But if we apply acupuncture at the early stage, it can reduce the persistent pain on day 70. Okay, and also reduce the reactive microglia, astrocyte, so reactive astrocyte, and restore the GABAergic neuron fiber loss. So this tells us acupuncture can reduce the microglia and the astrocyte activity to reduce pain hypersensitivity and the risk of the chronic pain. But how about the microglia on the CNS induced neural inflammation? So we use the traumatic brain injury model. So this is traumatic brain injury, TBI, and we use the weight drop. We do so LI4, LI11, EA, and we do the weight drop first. Then we treat 3 or 5 days electroacupuncture, and acupuncture can improve the behavior, including the sensory and the motor function. As you can see here, this is dental pulp injury induced microglia activation in cortex and the hippocampus. But if we treat EA, it greatly reduces this response, reduce the microglia activation, and Chen EA has no effects. Also the astrocyte. Okay, so EA reduced the astrocyte activation. Okay, and we conclude this is something to do with the HDAC inhibition, but because of the time, maybe I skip this. So EA can reduce the HDAC expression in the cortex. The next topic is we want to know, is there any alternative method of acupuncture to downregulate microglia to produce neuroprotection? So we use the topical menthol treatment on the skin TRPMA receptor to see if they can downregulate the microglia and astrocyte. Okay, so we use the stroke model. We apply the menthol to the forepaw like this. Just 1 minute first day, then 15 seconds from day 1 to day 7. Okay, and then we found if we apply the menthol to forepaw, it can reduce the stroke infections volume. And also, it can greatly reduce the microglia activation and the astrocyte activation induced by the stroke. Okay, so it means if we apply menthol to forepaw, it can produce something similar to acupuncture to reduce microglia and astrocyte. Okay, so we publish this and also get a patent in Taiwan and Japan and other countries is pending, application is pending. And we make the product like this. So inside is menthol. Then we ask, can this useful for a stroke patient? So we perform a clinical study. So each group, 30 stroke patient. So we give 5 minutes a day and 5 days a week. So for 4 weeks. So the result is encouraging. As you can see, the menthol glove group, it has a higher Barthel index. So it means the menthol containing glove and the socks enhance the self-care ability of the stroke patient. Also the MRS score. So it means it's lower MRS score. It means the glove can improve the function outcome of the stroke patient. So our conclusion is, so for acute analgesia, acupuncture can go through opioid system and the orexin endocannabinoid system to produce analgesia. And the menthol and it's a TRPMA receptor is required for the opioid system to activate. And the acupuncture can also downregulate microglia and the astrocyte to reduce pain hypersensitivity and the chronic pain risk. Okay, acupuncture can also reduce CNS injury-induced neuroinflammation. Alternatively, we can apply topical menthol to act on TRPMA receptor to downregulate astrocyte and microglia to reduce neuroinflammation. And this idea is already proved by the clinical study. Okay, thank you. Thank you for listening.